Okay, so we have here the ESR or the erythrocyte sedimentation rate. Okay, erythrocyte sedimentation rate is one of your aqueous reactant. So aqueous reactants are actually mga test parameter that we tend to use here for evaluation of your inflammatory conditions. So ESR will help us then to identify the presence of your hidden but active inflammatory disease. Although this one is non-specific na test, into saying all types of inflammatory reaction, this will have here an increased results. Although there are several factors that try to affect the test results of your ESR. So as what we have discussed in the lecture, so this include number one, mga RBC factor natin like the size. So pag malaki ang size, so mabilis siya ang ESR natin. Okay, another one is pag the number of the RBC, pag konti ang RBC in the case of your anemic patient. Okay, so it would have also here the faster na eventually na settling process. And there are other factors also like viscosity of your plasma or even mga plasma proteins natin and some of the technical factors we have taken up in the lecture. All of it one try to affect the test result of the ESR. So ESR is just the rate, it's just measuring here the rate of the settling process of the RBC after an hour. Because to try to allow the RBC here to settle for 1 hour time duration. So, okay, pag bumaba na sila, that's the settling process. So, that's what we are monitoring, determining here in the ESR test. Okay, so there are 1 hour is divided here into 3 stages. Okay, the first 10 minutes here is the period of your low formation. For the RBC, in order for them to settle, so it should undergo a rouleau formation. Okay, in order for you then to allow the RBC to undergo rouleau formation, because by nature RBC would have, they are negatively charged, so they will not allow them to stick to one another. They will not be able to form here the rouleau formation, not unless you try to destroy the zeta potential or the negatively charge that will enable our RBC to undergo rouleau formation. Okay, the next 40 minutes here, the period of your rapid settling. And the last 10 minutes here would be the period of your final settling. When you're already on the last 10 minutes, expect here na medyo mabagal na ang RBC. Na-settle natin is because kung dito siya kanina, majority of your RBC ay andito na sa baba natin. Okay, we have here the method for the ESR determination. We have here your Winthrop or the Landsberg method. Okay, so Winthrop in the Landsberg method. So this method here utilize your Winthrop. Sorry, dapat ang your Winthrop strobe would have your two na markings. One is in the left. Okay, for the ESR. Well, dapat dito pala sa left. Mali ang drawing, but kaya nilibalan ko lang ng left. Again, the left side is for the ESR. That one would have your 0 sa baba and 10 dito sa taas. And each of that one is divided further into smaller graduation marks. So from this one, 0 to 1, there are 10 of that. So that's equivalent to your 10 mm. So from 0 to 10, na dito sa taas, that gives you 100 mm. Okay, the other side of your Winthrop, ginagamit natin for the hematocrit determination. So ito ang kanyang natin, kanyang graduation mark. So 0 sa taas, 10 dito sa baba. Okay, procedure for that, just need to fill in this one with our blood. So you need to make sure that your blood is eventually being well mixed. You can use here you can also use the double oxalate. Actually, you can use also your so your double oxalate or the ETA for the Winthrop. Okay, try to fill in your Winthrop tube here up to that one na mark. Make sure na wala siyang bubbles, wala siyang space. Okay, then let it stand sa support natin. You can put this one in your test tube. Okay, and then allow it to put that one in your test tube rack. Allow it to stand for straight the vertical position because dapat hindi siya naka-inclined, naka-tilt. Because again, as what we have discussed in the lecture, pag tinilt natin, it will have an effect with your ESR. So that's why just allow it to stand here in the straight vertical position for 1 hour. Then after 1 hour, so bababa na ito dito. Ay, mali pala ata. Okay, Wait lang ha. 0, ito pala. Ang 0 to 10 natin, that's for the ESR. Tama nga talaga siya. Okay, 0 to 10 natin, that's for the ESR. Kasi dito tayo mag-read, pababa kasi siya. Okay, then dito sa pataas is your hematocrit. Okay, so this is your left side. So tama, this is your right side. But then again, pareho pa din itong graduation mark niya dito sa side natin. Then after 1 hour, you try to read the result here kung ilan ang binaba niya. Okay, and then try to report that one as your mm per hour. Okay, that become your ESR na result. Okay, another method you can use also your Westergren na tube. So Westergren na tube here, medyo would have your longer na column. Approximately could have your up to 200 na mark. So this is your 0 na mark. Dito ang 200 natin sa baba. Sorry. Okay, so procedure for that, you just need to have your EDTA collected tube. You can also use your black, okay, na citrate, that's for the ESR, yung 1:4 natin na anticoagulant blood ratio. So all you need to do here is just, papasok ko lang ito dito sa ating EDTA, tapos meron siyang dito parang, ganyan no, parang marker, stopper. O kapag pinasok mo ito, so ito ay magkakaroon ng pressure dito na side. Medyo masikip kasi because of this one. So, pag nilagay mo ito dito, pag sumikip na ito, it would allow your blood here in your eto tube or even the citrate na black na tube to allow your blood here para mabakit dito sa taas. Then, may stopper din dito sa taas para hindi siya sumobra. Then, after that one, again, allow it to stand straight here in the vertical position for 1 hour. And then, try to record the result lang as mm per hour pa din. Okay, that's for your Westergren na tube natin. Okay, so thank you.